Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Hip injuries and disorders. Introduction. Your hip is the joint where your thigh bone meets your pelvis bone. Your hips are very stable, but there are many injuries and disorders that can affect your hips. Treatment for hip disorders depends on the problem. Treatment may include rest, medicines, physical therapy, or surgery, including a hip replacement. This program covers common injuries and disorders that affect the hip. It also talks about treatment options. The hip. The hips are the largest ball and socket joints in the body. Ball and socket joints are named for the ball-like top of one bone moving in a cup-like space of the other bone. The surfaces of the ball and socket should be smooth and allow painless movement. Many ligaments surround the hip joint. Ligaments are tough tissues that connect one bone to another. They stabilize and support the joint. Muscles and tendons help the hip move. All muscles are made of an elastic tissue. Small fibers make up each muscle. Tendons are the tough cords of tissue that attach muscles to bones. They help your muscles move your bones by pushing or pulling the bones in different ways. Cartilage is a material that keeps the bones from rubbing against each other during motion. It covers the ends of the bones in the hip joint. A small bag of fluid called synovium sits between the two pieces of cartilage in a joint. The cartilage and synovium allow for smooth, painless motion of the joint. A bursa is a small, fluid-filled sac that acts like a cushion between a bone and other moving body parts such as muscles, tendons, or skin. They are lined with synovial membranes. General symptoms. Symptoms of hip injuries and disorders can vary widely and depend on the problem. The most common symptom is pain in the buttocks, groin, hip, thigh. Other common symptoms of hip injuries and disorders include bruising, difficulty walking, inability to move your leg, swelling or weakness in the joint. Some hip injuries and disorders may also cause feeling of a pop or tear, numbness in the leg, foot, or toes, redness or tenderness at the joint, stiffness in the hip, weak bones that break easily. Hip injuries and disorders can cause other symptoms as well. If you notice any of these symptoms or other changes, talk to your healthcare provider. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Sprains, fractures, and dislocations. The hip can be injured in many ways. These include sprains, fractures, and dislocations. A sprain is a stretched or torn ligament. There are many ligaments in the hip that may become sprained. Sprains can happen if a person experiences a sudden blow to a joint, falls on their hip. Treatment of sprains depends on the severity of the injury. It usually involves resting the injured area, icing it, wearing a bandage or device that compresses the area, using medicines. Later treatment for sprains might include exercise and physical therapy. Exercise helps to prevent stiffness and increase strength. Physical therapy helps strengthen the injured area to make it more stable. A fracture happens when a bone breaks. A broken hip can involve either a femur or pelvis fracture. Fractures can happen at the same time as sprains in the hip. You can fracture the hip by being in a car accident or experiencing another trauma, falling on the hip, especially in older adults. Osteoporosis is a disease that causes the bone to become weak. Bone weakness can lead to fractures of the hip. Often, hip fractures need surgery to repair them. Metal screws or a rod may be inserted to hold the bones together. Some or all of the bones in the joint may need to be replaced. You may need to use crutches to keep weight off your hip while it heals. You will likely need physical therapy for a few weeks or longer to help get strength back in the injured hip. Medicines may also be given to strengthen bones. This can reduce the risk of a second fracture. Dislocations are joint injuries that force the ends of your bones out of position. A hip dislocation happens when the head of the thigh bone slips out of its socket in the pelvis. The cause of a hip dislocation is often a fall or a blow, sometimes from playing a contact sport. Other causes include a fall from a height, such as from a ladder, trauma to the joint, such as during a car accident. You may not be able to move a dislocated hip joint. Dislocated joints are often swollen, very painful, visibly out of place. A dislocated joint is an emergency. If you think you may have one, seek medical attention right away. When properly repositioned, the hip joint will usually function and move normally again in a few months. Treatment for a hip dislocation might include a splint, manipulations to reposition your bones, medicine, rehabilitation, rarely surgery. Bursitis. Bursitis is a common condition that causes swelling around muscles and bones that often affects the hip. Bursae are found throughout your body, including the hip. A bursa is a small, fluid-filled sac that acts like a cushion between a bone and other moving body parts, such as muscles, tendons, or skin. Bursitis happens when one of your bursae becomes inflamed. Bursitis is usually caused by direct injury to a joint, overuse, repeated injury to a certain area. Inflammation of a bursa may also be caused by arthritis, diabetes, infection, thyroid disease. The first step in treating bursitis is to reduce pain and inflammation. This is done with rest, compression, elevation, anti-inflammatory medicines. Your healthcare provider may advise you to limit the amount of activity involving the hip to encourage healing and prevent further injury. They may, however, recommend physical therapy in some cases. Severe cases of bursitis may be treated with steroid injections around the injured area, ionophoresis, therapeutic ultrasound, surgery. Arthritis. Arthritis happens when the cartilage in the synovium in joints is inflamed or destroyed. Arthritis can affect the hip joint. Osteoarthritis is due to chronic wear and tear. It is more common in older people. Osteoarthritis happens due to repetitive use of the joints. This leads to wear and tear on the cartilage in the joint. Post-traumatic arthritis is due to trauma to a joint. Trauma may happen during a car accident, sports injury, or other types of trauma. If the synovium in a joint becomes inflamed, it could end up being destroyed. This destruction is called rheumatoid arthritis. The cause of rheumatoid arthritis is unknown. In rheumatoid arthritis, the immune system of the body attacks the synovium of the joint, destroying the joint. Rheumatoid arthritis may run in some families. There is no cure for most types of arthritis. Arthritis can be controlled with various medicines that decrease inflammation in the body. Physical therapy may be used to keep joints in shape. Splints are commonly used to prevent, slow down, or make up for joint deformities. If other treatments are unsuccessful, surgery to fuse or replace joints may stop deformation and increase use of the joint. Avascular necrosis. Avascular necrosis is a disease caused by reduced blood flow to bones in the joints. The hip joint is most commonly affected. In avascular necrosis, The lack of blood causes the bone to break down faster than the body can make enough new bone. The bone may die and break down. Avascular necrosis can affect men and women of any age, but it usually strikes in the 30s, 40s, or 50s. No one is sure what causes avascular necrosis. Risk factors are alcohol abuse, having certain diseases, including arthritis and cancer, joint injuries, long-term steroid treatment. Treatments for avascular necrosis include medicines, limiting activities, physical therapy, electrical stimulation, surgery. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Your hip is the joint where your thigh bone meets your pelvis bone. There are many injuries and disorders that can affect the hip, including sprains, fractures, and dislocations, bursitis, arthritis, osteoporosis, avascular necrosis. Symptoms of hip injuries and disorders can vary widely and depend on the problem. The most common symptom is pain in the buttocks, groin, hip, thigh. Talk to your healthcare provider if you think you may have a hip injury or disorder. Treatment for hip disorders depends on the problem. It may include rest, medicines, physical therapy, or surgery, including a hip replacement. Thank you for using Explain.